As we heard yesterday, 3 travelers who visited Boston last week for the conference in the city, the Biogen conference, have been diagnosed with the coronavirus. That includes the Tennessee case announced by their health department yesterday that incorporated Massachusetts in that. None of these travelers are Boston residents. We now have new information that there have been 3 confirmed cases of coronavirus of Boston residents tracing back to the same Biogen meeting. This is a rapidly evolving situation. We want everyone to know that we are ready for a safe and effective response to what this information is coming out seems like every 10 minutes. We've been preparing since January when we activate our internal incident command system. Our preparedness efforts will continue to be adjusted if needed. We are happy to hear that the UMass student, and many of you have been asking about the UMass student, the first diagnosed case of coronavirus back in February, is doing well and continues to self-isolate in his off-campus dorm. Close contacts of his may have been exposed to the virus and were monitored. We've been monitoring, and the signs of symptoms have been being monitored there. We continue being in constant contact with the Mass Department of Public Health, and I just want to take a moment to thank the Department of Public Health, who have been an incredible partner here and doing some incredible work. I want to thank the CDC and other partners. I want to thank also Senator Markey's office is here today, representing Senator Markey in the work that he's been doing on the federal level with us. The Boston Public Health Commission and the Boston Emergency Medical Services are both well trained to respond to infectious diseases. Our Office of Emergency Management will activate the Emergency Operations Center if it's needed. Chief Martinez will speak more about the work being done on a city level and what we're doing here in the city of Boston. We're also working closely with all of our partners, with our hospitals, with our health centers, with our schools, with our community centers, with our universities, to make sure, and with our seniors and other folks in the city of Boston, to make sure that everyone has the information, the resources, and the training to respond to any potential concerns that people have. We're sharing the latest information from the CDC. The Boston Public Health Commission has fact sheets available in multiple languages, so we're making sure that other languages and people with other languages and from other countries in the city have the information at their fingertips, so they don't have to figure out what is it saying. Residents can also go, in the city of Boston, residents go to boston.gov/coronavirus for the latest updates. You can call the 311 city hotline to be connected to the Mass Helpline. And we're looking to increase our 311 lines for the expected increase in volume and calls that we're going to get. As you can see, this truly is an all hands on deck approach. We're working together on this. There's no space between any of us in this issue because there's still such an unknown that we're all, including the press in this room, are trying to figure out. I want to thank all of our partners, again, state and federal partners, for their support. I also want to thank our first responders and health professionals on the front lines, both that work for the city and the state, but also in the private sector and the hospitals that we have here in the city of Boston and the Commonwealth of Massachusetts. They're ready to reach and help any challenge that comes their way. We're going to continue to deliver for the people of our city to make sure that they get the best care possible. Lastly, I want to remind everyone that we all have a role to play in keeping our community healthy. We're in the middle of a flu season, so remember to wash your hands often. And I know that Secretary Sudders is probably going to talk about this. I missed the demonstration the other day, but she's going to show me in a little while how to truly wash my hands. But it's important that there's a lot of unknown, which is causing potentially a lot of fear. And and it's going to be repeated by everybody. Washing your hands is key. Making sure that if you cough or sneeze, cover your mouth and your nose. If you're feeling sick, simply stay at home and contact your healthcare provider. Don't self-diagnose. Make those phone calls because sometimes people are concerned. A lot of what we can do, the best thing we can do today is work on prevention. And prevention is by doing all the things that have been laid out and constantly repeating to other people on what to do. Remember also to look out for those people who are vulnerable, especially our seniors, our young people, and people with a medical history. What I mean by that is if you have residents on your street, check on your residents, check on the neighbors, make sure they're feeling well, making sure they're checking in with the healthcare providers. A lot of people don't have any family that can't do that. So we're asking you to do that here in the city of Boston. Make a phone call. Just knock on the door to make sure that they're okay if they need any help. At the end of the day, we must remember that we are a city of heart and a city of neighborhoods and neighbors, and we look out for each other and we work with each other. And I think the governor will be saying the same thing as far as it comes to the Commonwealth of Massachusetts. I want to again just thank the press for being here today. You have a responsibility. You are the people that will get the accurate information into the living rooms of people in the Commonwealth of Massachusetts. We expect you and need you to get that accurate information so that we don't cause panic. So thank you for being here today.